Welcome back to the exhibit hall. I'm your co-host, Dr. Damon Durker, Director of Optometric Services at Eye Surgeons of Indiana in Indianapolis. I would like to introduce our next guest. Dr. Thanh Mai is an optometrist whose specialty is contact lenses. He's a partner at Insight Vision Center in Costa Mesa, California. Our session is going to be why use Ortho-K for myopia management in your practice. Dr. Mai, welcome.
Yeah, thanks for having me. You guys have an awesome event. I'm impressed by just the logistics of it, of putting it all together, and just the graphics of all. Amazing.
I've had the opportunity now. This is my fourth event with the Eyes On team, but my first one live in studio to kind of see how the magic happens, and it is pretty amazing. So they've got a team that just has spent countless hours to make this happen. So it all looks really great for a reason, because it's just a lot of hard work.
Makes sense.
So
yeah, go ahead.
I'm glad you're enjoying the show. So talk to us a little bit about your practice. I know Costa Mesa, I did Google that. That's about an hour and a half north of San Diego. Tell us about your practice.
So my practice, we started cold in 2015. So in 2015, average one patient a day, right? And so brand new. No one knew we even existed. And we knew from the very beginning that we didn't want just a traditional optometry practice. And I like to say, I don't like to dabble. I like to go all in when I do anything. And so we decided that we wanted to create a world-class myopia management practice and vision therapy, as well as specialty contact lenses. So that's essentially my entire schedule now. I don't do any primary care. All of my patients on my schedule, actually, if they're not in for a special contact lens of some sort, a RGP of some sort, I wonder how they got on my schedule, basically. So it's what I do every day. I'm in the trenches seeing patients. I have the same staff issues that everyone else has, but it's been our major focus, and it's what I'm passionate about. And I hope others to do the same.
So that was in 2015. When did you graduate optometry school?
Graduated in 2012, and worked for a couple of years for other people, and trying to purchase other practices, trying to partner, and ultimately decided, you know what, this won't work out. I'm just going to open up my own, and it's been the best decision I've ever made.
So that is quite the leap of faith. I know that most of our colleagues don't make that decision. Was there one or two key things that drove you to do that, besides just what you found as the need in the market for this specialty service?
Yeah, definitely a need in the market. And for me, what drove me to do it is because I knew I always wanted to be in private practice, and I wanted to do it my way. And if there wasn't going to be a great opportunity to take over a practice or build an existing one out, just to do it on my own would be fine. We are in Orange County, California. There is an optometry school in my same county, and another one north of us in Western, about a 50 to 60-minute drive. And so we're definitely in an area that has plenty of optometrists. And so when you work in an area with plenty of optometrists, I think it's critical to specialize in a certain area and to really do it in a world-class way to set yourself apart. Because if you're trying just to do what everyone's doing, it's got to be challenging perhaps to make it, especially in independent optometry.
And I think our colleagues realize this in optometry. We have the optometry 2021 report in the conference bag. And we asked, 700-800 optometrists, what are the top two areas of growth within optometry? And it was in dry eye management, and then the focus of this session, myopia management. So I know that you've got a comprehensive myopia management practice, which is something that I personally don't really know a whole lot about. I'm in a medical surgical practice, and I refer all of those patients that require those services out to my colleagues in Indianapolis and beyond. But why Ortho-K in terms of all the different things that we can do? And I know you do lots of things in your practice. Why specifically are you such a strong advocate for Ortho-K?
Yeah, so we do all types of myopia management. And we don't have a specific allegiance to any way. Whatever works for the child is what we're going to do. Now, it just turns out, though, when you go over the patient profile, when you go over their history, their prescription, the axial length, corneal topographies, when you have the discussion with parents about the different options you can do, or the parents come in educated on their own, what typically happens, especially at our practice, is that when you talk about the lifestyle benefits of doing orthokeratology, when you talk about the dual purpose of it, which it can control axial length elongation, which is myopia management, as well as correct vision, that combination of doing both at the same time, it's when a patient hears that, they say, give me that. For the benefits from the practice side is that it really sets you apart because not a lot of offices offer orthokeratology. Not a lot of them have experience doing it. When you do it, your patients are extremely loyal to your practice. They refer other friends and say, sometimes the issue comes up of, I can't believe this works. And the patient is amazed when they're seeing 20/20 the day afterwards. And guess what happens? They tell their friends when that happens. So it helps to generate and build the practice as well. So it's a practice builder, but most importantly, it's good for the patient. And when patients hear about it, they opt for it over, I'd say, the majority of the time.
So what does that workflow look like if you have a patient that's maybe referred to your practice, a younger patient that's a good candidate for myopia management? How does that cadence work with the initial evaluation, recommendation for treatment? Is that all done in one visit, or how does that play out in your practice?
Yeah, it depends. So if they've already had their primary care exam, then in the consultation, we usually do axial length measurement. That is the most critical number that we follow and we track, axial length. If you are doing myopia management, you might hear conflicting things from other people, but I am of the opinion that if you're going to do myopia management, you should be measuring axial length. That's the first measurement we do. We also do a cycloplegic refraction, as well as take corneal topographies, especially because, again, we're doing a lot of custom contact lenses. At a minimum, that's enough. That is usually enough for you to make a recommendation in terms of what to do next. Now, if you are seeing the patient in your office, and so if you're listening to this, perhaps you have an office that does primarily primary care first, and you're just getting started in growing your myopia management practice. The one thing that separates the dabblers from the doers a lot of times is that the dabblers let's say you get a patient coming in with VSP, they just want glasses. Try to convert them over into an orthokeratology program or into a myopia management program on the spot. You'll probably fail because the information is still too new. The number one reason why patients don't sign up for a program that might cost a lot of money, not hundreds, but thousands of dollars, is because the information is too new. So I would add this small wrinkle. The goal of the primary care examination at that point would not be to discuss myopia management. It would be to book the myopia management consultation. At the consultation, you'll discuss all the options, the axial length, history of progression, whatever you need to do, and then make the recommendation at that time.
Do you feel like that's what most of our colleagues are doing, or do they try to all squeeze it in to a vision care exam or a wellness exam and then maybe have a less than stellar conversion rate to the myopia management treatment plan?
Yeah, I have coached and talked to over 100 optometrists in this how to install myopia management into their practices. I'd say the majority of them, or at least too many of them, are trying to kind of shove it all in there. And then they get frustrated when patients don't quite get it. And when patients aren't pursuing and moving forward with their treatment, and they believe maybe because it's too expensive or the price is too high. But it's really the setup. It's the work you did beforehand to educate the patients. Did you send them an email ahead of time? Did you send them a YouTube video explaining what you're talking about? Maybe you have a white paper or an ebook that you've written that you can send them ahead of time to educate them about what you do. The setup is what is important, and the communication is what's important to get the patients to understand why you're doing this and why it's helpful for their child. And so I'd say those differences there are very few offices I talk to initially do those.
Yeah, and I think there's a lot of crossover there into the dry eye world. You have to do the same thing as you can't have a wellness exam, comprehensive exam, and expect to manage all the intricacies of a dry eye patient. You really need to give some basic education, give them some tools to educate maybe outside of your office, and then come back and have a very focused visit, and then you can have a more targeted treatment plan.
Exactly. If you try to talk about we need to do IPL and lipoflow, blah blah blah, during your VSP eye exam, not going to work out. You
Yeah,
should
good,
book.
good luck
Yeah,
with that. So,
exactly.
so we all have busy practices, and maybe, I think most of my colleagues, I think you would agree during the pandemic here, we're as busy as ever
Yep.
in both primary care and in a referral center. So there's multiple ways that you can use technology with Ortho-K fitting with diagnostic trial lenses, different algorithms, computer software. What seems to be the best way to do that in your experience, in your practice?
Yeah, we've shied away from doing the fitting set method, at least at our office. And we do a lot of empirical fitting. What that means is we get the measurements, the topography, the horizontal visible iris diameter, the prescription, of course. And we usually order empirically based on that data. What we find that it's helpful for us, at least, is that it streamlines the consultation, makes it easier. It also shows the parent and patient that they are getting a custom lens, because if you're just getting from a fit set and throwing on their eye the same day, they might question whether or not it's custom or whether you're just getting a tray and using it on them. When you're ordering empirically, at least in our experience, 90% of the time to 95% of the time, we're done in the first or second lens anyways as well. So we haven't found a big need to have a fitting set, and we haven't used it in the last 6 years. And that would be my recommended approach.
So let's talk a little bit about specifics with Ortho-K technology. Toric peripheral curves. How do you use that information to help optimize centration and performance of the lens?
Yeah. So many patients have differences in eccentricity and K values. And when you have difference in steepness in your cornea and different meridians, a lot of times we're having a toric lens, for instance. That will help the lens center better. If the lens centers better and aligns 360 all the way around and seals better, then you get better treatment. Overall, if you have better treatment, you need less follow-ups. You have patients that have better vision. So the majority of times we're doing toric peripheral curves now.
So when you bring that patient back and you've done that process, what specifically are you looking for to measure success for those patients with Ortho-K?
Yeah. So obviously visual acuity, then checking the RX and looking at the topography. If the goal is myopia management, know that this sounds counterintuitive, but the goal of orthokeratology for myopia management is to steepen the cornea, not to flatten. The goal is to steepen the cornea, particularly steepening the cornea in that, so you get that myopic defocus in the peripheral retina. That's the secret sauce to controlling myopia that we found, right? So I'm looking to see if you get that nice red ring, ideally within the patient's pupil, so that they can get that myopia fix.
Yeah, so that's information that's definitely new to me. I have some understanding of kind of where the trends are, but that was nice to hear you explain that. So, you started from scratch, and maybe that's not what the majority of our audience here is looking at doing, but maybe they're looking at bringing this in as a new service into the practice, which you've already pointed out in Southern California, at least, is such an important thing to differentiate by specializing in an area that is passionate for you. So what advice can you give to newer doctors that are maybe thinking about bringing in myopia management into their practice? What are some of the first steps?
First steps is always changing your own mindset and your own psychology. That's the number one reason why people don't get this going, is that if you don't believe that myopia is a disease, and I said it's a disease, and that's what a lot of my colleagues believe, it's a disease of the eye in which children's eyes are getting too long, and there are visual and ocular consequences, especially later on, because of it. If you believe that first, like I do, then patients will come on board with you with it, because patients don't buy what you do, they buy what you believe in. And so first of all, I would say change your set of beliefs. If you truly believe that is the case, then you're going to treat it like you treat any other disease. You won't talk about treating myopia management as it's just an option for patients and that they maybe should look into it. You would treat it like you would a patient with glaucoma. If you have that mindset, then you're on the right track to creating a world-class myopia management. Know that the beauty of me opening cold is that I know exactly what you are going through if you even have 0 patients currently in your program. But I would start first from inside out. I would train yourself on all the different technologies out there, which is orthokeratology, custom soft multifocals, atropine, even specially designed glasses, I would look to get a coach, a mentor. And then from then on, I would start my plan inside out by training myself, my staff, and then I start going out into the community. But don't go into the community and start doing your marketing until you do the internal processes first.
No, I agree, and I've shared similar experience in dry eye management in my practice. Is you really have to become an expert, make sure your staff shares the same passion and level of expertise to some extent, and then market yourself after you've shown some initial success. Is there still a pretty big debate as to whether myopia is truly a disease? I mean, when I think about just the visual disability and then all of the sequelae of untreated myopia with glaucoma, retinal detachment, all of the things that can happen, maculopathy, is that still something that's not settled?
Based on yes, unfortunately, yeah, you and I are in alignment, and the good news is that we are the majority. But I know from my experience that not everyone believes that, and they believe it's just refractive. And what's the problem if they become a high myope? What's the big deal? It's just myopia. But I am a -9 myself, and my eyes are 27 millimeters in length, and so it's I know it's not good for me. And I have 2 kids, and so I think about them, and I think about the fact that when I was young, I had no chance. My parents had no idea. My eye doctors didn't even mention anything about myopia management. So I think of it from that perspective all the time. And so when I could change the course of someone's life, that's meaningful to me. And about.
Yeah, I've got a colleague in Indianapolis, Dr. Chris Browning, who has a similar story, -8 or 9. He's got 3 kids, and he said, yeah, I just don't want my kids to have the same lack of chances to correct their problem that, it just wasn't a possibility for him. So he's built a myopia management practice within his practice and has successfully treated his kids. And I think he's so passionate about it because he's lived through the consequences of having untreated myopia when we didn't really understand it like we do now, and we didn't have as many options.
Exactly. I think it's anyone that has high myopia, none of us disagree. We live with it every day. I wake up in the morning and I can't see anything. And so absolutely, it is a disease worth managing. It is, in my opinion, the biggest thing in optometry that would change in the next few years. It is coming on like a tidal wave. And myopia is only growing in proportion epidemically. And COVID, the studies have shown in actually the ages, for instance, we have studies of over 100,000 kids that in the age of 6, 7, 8 years old, it's sometimes doubled in those age ranges, the incidence of it. And so COVID is, when you look at the year 2020, then even the year 2019, 18, 17. So we're going to find that there are going to be even more kids who have myopia. And that's due to COVID, also due to the fact that we're just a little more sedentary and we love our iPads.
I don't think that's going away. Just like I'm not sure that the coronavirus is going away anytime soon.
Yeah, it's not. Yeah.
So I know you work with Euclid, and they're sponsoring this session. Why Euclid technology for Ortho-K?
Euclid is great. A lot of orthokeratology companies do a great job, but I'd say one of the key differentiators is the customer service, the support, the consultation, because when I first started, I knew nothing about doing orthokeratology. In fact, there are times I still have, even as I'm on the podium and I do a lot of teaching and lecturing, I still have imposter syndrome sometimes where I'm thinking, oh my gosh, at any moment, people are going to find out that I don't know what I'm doing. So the good thing about Euclid is that you don't need to know what you're doing yet. They can help you. The consultants can help you troubleshoot what's going on. And you can share the topographies, the prescription, and take a video of the fluorescein pattern, even just with your iPhone, and say, help, I don't know what I'm doing. And they'll help you out because they're really nice.
Yeah, so I would encourage everybody to go to the Euclid booth. I'm looking at their show specials. It's pretty impressive. Discounted lens bank packages, complimentary pair of warranted lenses for new customers. A lot of great information. I'm looking at it regarding Ortho-K in general, myopia management. Dr. Mai, it has been a pleasure. I hope you enjoy the rest of your weekend, taking the rest of Eyes On 2022. And it's very impressive what you've done in just 5 or 6 years in your practice, dedicated to especially contact lenses and myopia management. I think you have a lot of things to share. It sounds like you're doing that in education already. So it's been a pleasure.
It's been a pleasure. Thank you very much. Appreciate being here. And you guys do a fantastic job. Keep up the good work.
Thank you.